We like to do a lot of hiking, and so we're in the backcountry, and we've done plenty of hikes that are long ones, 7, 8 miles. So with Grant having CAH, that's absolutely something that's in the back of my mind all the time. Now that we have Crenessity, there are more options than just steroids for people with classic CAH like Grant. The level of stress has gone down significantly.
My name is Grant, and I love to play Fortnite. I love to do kinetic sand. I love climbing. I love running and a bunch of other stuff.
He always loves to paint. He loves to make slime. Anything that's messy, it's right up Grant's alley. So in the beginning, when we found out Grant had CAH, our minds were just racing, wondering what our future was gonna bring, wondering if he was gonna be just so sick, we'd have to keep him home all the time. Every time we would take Grant to see his endocrinologist, we would have blood work done, and we would always go over all of his numbers with the doctor. Every single time we would go, his numbers were always high, and his bone age was significantly higher than his age, and his numbers were showing he was prepubescent at 7 years old. Our doctor said it was because his androgens were always high. I just felt like we were always chasing numbers, just chasing the numbers rather than being proactive about it. I got a message one day, and it was just this letter inviting Grant to be a part of a study. We had an appointment with his endocrinologist, and she goes, he is a prime candidate to try this, and it comes in a gel capsule. He had to learn how to swallow a pill. So we started with Tic Tacs, and we slowly worked our way up through M&Ms and eventually to Mike and Ike's. Of course, he's got brothers, so all of his brothers were like, I need to learn how to take pills, and so that they could get candy too. He takes Crenessity in the morning with breakfast, and he takes it again in the evenings with his dinner. Because Crenessity lowered Grant's androgen levels and 17 OHP, his doctor was able to lower his steroid dose. Before we started Crenessity, I had started noticing with him, because we were getting into higher doses of hydrocortisone, I was noticing he was really poofy, and that went away. Our doctor said it was because of the decreased steroid dose. It's dropped by 40%, and that's incredible. He really didn't look like that little marshmallow anymore. Our doctor said the most common side effects in children were headache, stomach pain, tiredness, nasal congestion, and nosebleeds. If you have CAH and you're considering taking Crenessity, it's done wonderful things for my son Grant. We've had a great experience, and it's been truly helpful, 100%.
Important safety information. Approved uses. Crenessity crinecerfont is a prescription medicine used together with glucocorticoids, steroids, to control androgen, testosterone-like hormone levels in adults and children 4 years of age and older with classic congenital adrenal hyperplasia, CAH. Important safety information. Do not take Crenessity if you are allergic to crinecerfont or any of the ingredients in Crenessity. Crenessity may cause serious side effects, including allergic reactions. Symptoms of an allergic reaction include tightness of the throat, trouble breathing or swallowing, swelling of the lips, tongue, or face, and rash. If you have an allergic reaction to Crenessity, get emergency medical help right away and stop taking Crenessity. Risk of sudden adrenal insufficiency or adrenal crisis with too little glucocorticoid steroid medicine. Sudden adrenal insufficiency or adrenal crisis can happen in people with congenital adrenal hyperplasia who are not taking enough glucocorticoid steroid medicine. You should continue taking your glucocorticoid steroid medicine during treatment with Crenessity. Certain conditions such as infection, severe injury, or shock may increase your risk for sudden adrenal insufficiency or adrenal crisis. Tell your healthcare provider if you get a severe injury, infection, illness, or have planned surgery during treatment. Your healthcare provider may need to change your dose of glucocorticoid steroid medicine. Before taking Crenessity, tell your healthcare provider about all of your medical conditions, including if you are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Crenessity in adults include tiredness, headache, dizziness, joint pain, back pain, decreased appetite, and muscle pain. The most common side effects of Crenessity in children include headache, stomach pain, tiredness, nasal congestion, and nosebleeds. These are not all the possible side effects of Crenessity. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. Crenessity is available in 50 milligram and 100 milligram capsules and as an oral solution of 50 milligrams per milliliter. Please see the accompanying full prescribing information or find it at www.neurocrine.com/crenessityppi.